Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I've been partnering with the Council on Aging in St. Tammany for over 10 years. All of that time as a caregiver support group facilitator, and half of that time in bringing you Caregiver Coffee videos just like this one. Today's topic is going to be on urinary incontinence in older adults. So, not a fun topic, but nonetheless a really important one because this will impact maybe most of us, or will impact most of us, maybe all of us at some point in our lives. So this is a great article by the NIH that I found and reviewed, and we'll be going over the highlights and reading some sections. And of course, as always, I will leave a link, the link in the video description. All right. So before we get into that, just a little bit, as usual, about the Caregiver Support Group. We meet every Tuesday of the year unless it falls on a holiday. And the basic pattern is this from 6 p.m. to 7:30 p.m. on Tuesday evenings. Within the month, that's the first Tuesday. On the first Tuesday, we're in person and we're at the Slidell Activity Center. The second Tuesday of the month, we're on the Zoom platform, and you can do that. You can join us by just calling in from your phone, smartphone, or landline. You can use the Zoom app on your tablet or smartphone, or you could use your home computer and have the camera on or not have it on. We love to see your face if you want to turn your camera on. On the third Tuesday, we're at the Senior Center, Senior Activity Center in Covington off of Highway 190. And on the fourth Tuesday of the month, we're back on Zoom. Now, there are some months of the year that have a fifth Tuesday, and sometimes we meet and sometimes we end up taking a break. We will let you know. And there's some ways to keep in touch and know exactly where we are besides knowing that, that weekly pattern that I just described. And that is to get on our mailing list, our private email list for the support group. We have over 100 people that are on it, and but we usually have six people on average at our group meetings. And I just mentioned that to say that just because you're on the email list doesn't mean that you have to show up. Some people show up once a month, once a quarter, once a year. It just kind of depends on what their schedule is and their interests and what else they have going on. So I encourage you to get on that list. And here's how you can get on that list and get access to our calendar. So you want to go to coastseniors.org, go to Caregiver Services. You'll have a few clicks and then you'll find my picture, and there should be a link to a PDF document. That document is a flyer slash calendar that we publish every 2 months. And on that, we tell you exactly where we are for that week on the date, and the address, including the address. And then if we happen to be Zoom on a date you're looking at, it has the Zoom link. It's got the phone number, everything that you need. It even has my phone number if you need to reach out, call me or text me. And some people do that on occasion. You never have to sign up or RSVP. You just show up and you stay for as long as you want to. Most people stay for the 90 minutes, but if you only have an hour, you need to get back home, that's fine too. So I hope that you'll consider joining our really special group, and hope to see you and meet you in the future. If Tuesdays are not good for you ever, just let me know, and I'll do my best to try to find you a support group in our area that meets in person or virtually, since I know many of the facilitators. All right, let's get into this really good article, Urinary Incontinence in Older Adults. Urinary incontinence means that a person will leak urine by accident. And while it can happen to anyone, urinary incontinence, also known as overactive bladder, is more common among older people, especially women. And these bladder control issues can be very embarrassing and cause people to avoid their normal activities, so to isolate themselves. But it can often be stopped or controlled. So what happens to the body to cause these different problems? And there's lots of, oh, by the way, there's lots of hyperlinks in this article too. So another reason why you're going to want to visit the link and look at it so you can do more research into some of these topics. So located in the lower abdomen, the bladder is a hollow organ that is part of the urinary system, which also includes the kidneys, the uterus, and urethra. During urination, muscles in the bladder tighten and move urine into the the tube-shaped urethra. At the same time, muscles around the urethra relax and let urine pass out of the body. And when muscles in and around the bladder don't work as they should, urine can leak, resulting in urinary incontinence. It can happen for many reasons. It could be a UTI or a urinary tract infection, a vaginal infection or irritation, or even constipation. There's a separate article on constipation. Some medications can help control this, that problems that last for a short time. And when incontinence lasts longer, it may be due to weak bladder or pelvic floor muscles, overactive bladder muscles, damage to nerves due to diabetes, multiple sclerosis, or Parkinson's disease, diseases such as arthritis, making it difficult to get up quickly or to get up and to quickly get to the bathroom when you sense that you need to go. Um, Pelvic organ prolapse, which is when the pelvic organs such as the bladder and others shift out of their normal place into the vagina or the anus. Most incontinence by men is caused by the prostate gland. It can be caused by a painful inflammation of the prostate gland. It could be injury or damage due to damage to nerves or muscles from surgery, or it can be an enlarged prostate, which can lead to BPH or benign prostate hyperplasia, a condition in which the prostate grows as as men age, and there's a separate article for that. There are four types of urinary incontinence: stress incontinence, urge incontinence, overflow incontinence, and functional incontinence. And I'll go over those briefly. So stress incontinence occurs when urine leaks, when there's pressure put on the bladder, such as someone is exercising, they're coughing, maybe they're sneezing, or even laughing. Could be even when they're lifting heavy objects. It's the most common form of bladder control problem in younger and middle-aged women. It may begin later around the time of menopause. So that's stress. Think about these are stresses, sneezing, laughing, coughing, lifting heavy objects, etc. So it's stress incontinence. Urge incontinence, it happens when people have the sudden need or urge to urinate, and they cannot hold their urine long enough to get to a toilet. It may be a problem for people who have diabetes, Alzheimer's, Parkinson's, multiple sclerosis, or stroke. Next is overflow incontinence. This happens when small amounts of urine leak from the bladder that is always full. A man can have trouble emptying his bladder due to the BPH we talked about, benign prostate hyperplasia, in that the prostate is blocking the urethra. Diabetes and spinal cord injuries can also cause this type of incontinence. And then finally, there's functional incontinence, and that's when people have normal bladder control. However, they end up leaking urine because they're not able to get to the toilet fast enough because of arthritis or another type of condition that's preventing them from getting to the restroom in time. Right, there's a great little sort of like grayed out box here with some tips on incontinence and Alzheimer's disease. So many times in the late stages, people with Alzheimer's will have problems with urinary incontinence. It can be the result of they're not realizing that they need to urinate. They may forget to go, or they may not be able to go find the toilet when they're looking for it. So the recommendations are to avoid drinks like caffeinated coffee, teas, and sodas, which may increase urination, but don't limit water. Keep the hallways clear, keep the bathrooms clutter-free, keep a light on at all times. Provide regular bathroom breaks, use underwear that's easy to get on and off, and use absorbent briefs and underwear for trips where you're out of the home, away from the home. And there's actually, I don't remember the name of it. You can reach out to me if you need to know, but there's a special um, incontinence product for men that is not a brief. It's something that wraps around the penis and but I'm not thinking of the name right now, but I do have it written down elsewhere. So if you're interested in that, it's for men only, but it has great reviews and is available online. All right, so jumping into the section of treating and managing urinary incontinence, and there's a couple of things that we'll talk about in our last 5 minutes. A combination of treatments may help you get better control, and your doctor may suggest the following: bladder control training, and under that we've got pelvic muscle extensions, also known as Kegel exercises, that strengthen the muscles that support the bladder and help you hold urine in your bladder and avoid leaks. And there's a link to pelvic floor exercises. And these are good and they're very recommended. Urgency suppression. This helps control strong urges to urinate. For example, you may try distracting yourself to keep your mind off of the need to urinate, taking long, relaxing breaths, holding still, or squeezing the pelvic floor muscles. Timed voiding. This is used to help you control the bladder through scheduling time to urinate. For example, you may set a plan to go every hour, just on the hour, whether you feel it or not. You go and you set your timer, your kitchen timer, or your smartphone, and do that. Now we're getting into the medical treatments, and of course, I can't recommend any of these. These are just what we know is available, and this is a careful discernment between you and your family and your doctor on what's going to be good, because I just don't know the side effects, right? No one knows the side effects, and they may be unique for you. So there are medications that come in a pill, a liquid, or a patch that may be prescribed to help. Some medications for overactive bladder have been associated with cognitive decline, though, in older adults, those over 65. So you want to be careful with those. Vaginal estrogen cream, it may relieve the urge or stress continence. A low dose of estrogen cream is applied directly to the vaginal walls and urethra tissue. Next are bulking agents. These are used to help close the bladder opening. The doctor can inject a bulking gel or paste that thickens the area around the urethra, and this can reduce stress and constant continence, but it may need to be repeated. Next are medical devices. They may be used, such as a catheter that drains urine from your bladder, a urethral insert that helps prevent leakage, or a vaginal pessary ring that provides pressure to lessen leakage. Biofeedback uses sensors to help you be aware of your body and that you're needing to go to the restroom. This may help you regain control over your muscles in your bladder and urethra. Electrical nerve stimulation sends mild electrical currents to the nerves around the bladder to help control urination and your bladder's reflexes. And finally, of the medical interventions, surgery can sometimes improve or cure incontinence if it is caused by a change in the position of the bladder or blockage due to an enlarged prostate. All right, just not much left to go in these 2 minutes that we have. Hit my timer. So there are also behavioral and lifestyle changes. Changing your lifestyle may help with these issues: losing weight, quitting smoking, and avoiding alcohol. Instead, drinking water can help, especially limiting drinks before bedtime, these drinks before bedtime. Preventing constipation and avoiding lifting heavy objects may also help with incontinence. Even when treated, even after treatment, some people still leak urine from time to time, and there are bladder control products, disposable briefs, furniture pads, urine deodorizing pills may help. So, and then there's the ones for men that I mentioned. When to expect to see a healthcare provider, when to see them, and what to expect. Talk with your healthcare provider about urinary incontinence if you have these signs: needing to urinate more frequently or suddenly, cloudy urine, blood in the urine, pain while urinating, passing only small amounts of urine after strong urges to urinate, and having trouble starting or having a weak stream while urinating. So let's see, your doctor may recommend urodynamic testing to perform the following to try to figure out what might be causing it. Physical exam, including medical history, taking blood and urine samples, examining the inside of your bladder using a cystoscope, filling the bladder with a warm fluid and using the cystoscope to check out how much fluid your bladder is holding before leaking, ordering a bladder ultrasound to see if you're emptying your bladder fully after each void, and ask you to keep a daily diary of when you urinate and when you leak urine. So, um, interesting topic, certainly a really interesting topic because this can be, as we mentioned in the beginning of the article, it can be isolating. You might avoid going to social activities and doing, things that matter to you if you experience these. So I hope that you're not experiencing any of these symptoms or any of these four types of incontinence. But if you are, I encourage you to go see your medical provider because they can do things about it and help you to continue to do the things that matter to you most if you've been limiting yourself or if you've just been, getting through it and not enjoying it. I encourage you to do that. So. Thank you. Thank you for being here. Thanks for being here for, all the caregiver coffees that you join us for. Please consider sharing this. And of course, the article will come in the video description. So you're sharing the article as well. Maybe you want to print it out so you can read this in more detail, or even just go to it so you can follow some of the hyperlinks here so you can learn more about constipation, urinary tract infections, BPH, etc. So thanks again for being here and supporting the Council on Aging in St. Tammany. I hope that you get to see more caregiver coffees in the future. Take care.